Welcome to another edition of Inside Medicine. I'm your host, Doug Geinzer, the CEO of Las Vegas HEALS. HEALS being an acronym for Health, Education, Advocacy, and Leadership of Southern Nevada. We're here in the studio today with Becky Torres, the owner of the West Central Territory of BrightStar Care right here in Las Vegas. And we're going to learn a little bit more about what she does to care for our community. If you're new to Inside Medicine, we broadcast live in the studio here on Thursdays at 10 a.m., and we rebroadcast out on YouTube, Stitcher, iTunes, pretty much every one of those little social media platforms that's available, and it gets inserted into our HEALS Headlines newsletter, which delivers in your inbox every 2 weeks. We like to bring in leaders of healthcare here in Southern Nevada, learn what they're doing to improve the quality of care, that which is in the mission of Las Vegas HEALS. And today we're going to talk to Becky about what she's doing to care for our community. Becky, welcome to the studio.
Thanks, Dad. Good morning.
Yeah, so before we dive in and get to know a little bit more about BrightStar Care, we want to get to know Becky. Okay. Tell us a little bit about yourself. You're pretty much a native of Las Vegas. Tell us a little bit.
So I moved here when I was 5. My family moved here from Los Angeles. My dad said we were going to be here for 6 months. I promise, just 6 months.
We all said that.
Yeah.
We all said that. 6 months, maybe a year. And then we find Las Vegas is the most beautiful place on earth.
Exactly. So my family has been here since 1976, and we love it, obviously. I went to school here, grew up here, went away to college for 4 years, and moved back after college, and met my husband here, raised our kids here, and
so you studied to become a teacher, and you taught for a couple years.
I did.
It's quite a difference to go from education to healthcare. So we want to find out the why behind that. And before you got into healthcare, you were a stay-at-home mother. So tell us a little bit about your career ladder.
So when I moved back to Las Vegas, I became a teacher, and I worked for the Clark County School District for 4 years. And when I had my son, who is now 19, I stayed home and became a stay-at-home mom. And I did that until I bought BrightStar. And everyone always says to me, how did you end up owning a home health care company? And so my husband manages Trader Joe's. He was traveling all over the country for a regional vice president job, and we were all miserable. And so one day he went and said, I want to go back and manage a store. So he did that. And at that point, he said, we should start a business, which meant I should start a business. And so on a hot August day, very much like it was last month, I sat on my couch and I literally Googled my way into owning a business.
So BrightStar wasn't the first one that you came across. You looked at a bunch of different franchises, but what made you land on buying the BrightStar franchise?
So I think that one of the things that just kept coming back to me is wanting to do something to make a difference. And I felt like that every time I believe in divine intervention, and something just kept pulling me back to healthcare. And knowing that every day we could get up and make a difference in people's lives and do something that gives back to the community. And on really rough days, the joke around the office is I should have opened a yogurt shop. But but here we are, and we've done phenomenally well. We've grown. I mean, we have over 180 employees. And I think about, 7 years ago, it was 2 people. It was me and a branch manager. And I'll never forget the first phone call that we got saying, oh, we have a client for you. And us running around the office going, what do we do? What do we do?
And you've kind of taken the market by storm. You've taken the franchise world by storm. You were recognized as the franchisee of the year. So tell us a little bit about that.
So yeah, I was the rookie of the year. My first year being open. It's very exciting. I mean, being a woman in this industry, a lot of my counterparts around the country are male or husband and wife teams, and I'm one of the only truly women-owned ones. And I have a great support system. I had a meeting here last week, and it was 7 franchisees and 4 people from the corporate headquarters, and I was the only woman in the room. And I like that. I think it's exciting. It offers some challenges, because I still have to balance, raising my kids and being a mom to them, but also, coming in and making sure that we can, play with the big boys.
Yeah, and you've been recognized or you've been covered in several national media, including the Huffington Post and the, the Business News Daily. Tell us, what was that article about?
I think, it was the journey about becoming going from a stay-at-home mom to a business owner, and how as a woman you have to really balance a lot of those things. And, it's that adage of, oh, you need to have it all. And, I think it's some days you're going to be the best wife and mother, and other days you're going to be the best business owner. And it's figuring out how to be those for, different times, and having a great support system. And, a lot of people that I employ are women and moms. And, we know that, when we get that phone call that we got a sick kid, we're the ones that are going to have to leave the office to go and handle it. But we have each other's back. We support each other in that. And we know that, I might have to leave to go watch my kid in a play, but I'm going to work a little bit at home that night, or I'm going to work harder during the day. And so I think it's a really unique situation that we're in, and figuring out how we can be successful at doing everything without having to sacrifice ourselves and our sanity in the meantime.
Being the owner of BrightStar Care gives you that flexibility. Tell us about BrightStar Care. What exactly is BrightStar Care?
So we are a personal care home health company. So we don't do any Medicare and Medicaid. So we're a very unique hybrid. There's not a lot of people that do what we do in this space. A lot of companies are just personal care agencies, or they're Medicare home health companies. So for us, we are mostly private pay. We work with insurance companies and workers' comp, but we kind of step in where Medicare and Medicaid step off.
Gotcha. And so some of the other services, you talked about home health care, personal care. Give us some scenarios of a typical day in the life of BrightStar Care.
So I had this vision that when I opened, that people would call us up and say, oh, my dad is getting discharged from the hospital next week, and we want to interview some companies. Can you tell us a little bit about yourselves? And the calls that we get are, Friday night at 5:00 saying, my dad's getting discharged in an hour. Help. I have no idea what we need to do. And so we really are solution oriented, and that's what we do. We come in and help families when they are at their most dire times, and really act as advocates for them and help them get set up in their home back to, our ultimate goal is to get people better. And there's nothing greater than, we had a family member that walked into our office a few months ago to invite us to her mother's 100th birthday.
Wow.
And she said, my mom would not be here if it were not for your team that got her here. And so it's those moments that we love that, and that's what we strive for, and that's what we really want to do.
And so you've got 180 employees that help you be different than other home health services. What other areas, what helps you differentiate from the others? There's a lot in town, but what helps you differentiate from the others?
So the fact that we have two licenses, we do the skilled nursing side and the personal care side. So if somebody starts off just needing personal care, and then they become, sicker or need additional help, we're able to step in and flip that over to being more medical. And we have a director of nursing on staff. So that's huge. So we just do a ton of training. We have something called field specialist, where we have employed 4 people that are, the liaisons between our office and our families and our caregivers, because it's a very lonely industry, really. You're out there in a home one-on-one with the patient. It's not like working in a hospital. If something goes wrong or you have a question, that you have a team around you. You're working one-on-one with people. So we try to offer that support to help them thrive in a situation. And so, people will call us up and say, I need extra training on this. We have a training room at our office, so we can bring them in and teach them how to use a Hoyer. We can teach them how to, transfer somebody in a bed, all those things that it's very hands-on, and we really, really strive to differentiate ourselves that way.
We're going to take a quick commercial break, but when we come back, we're going to talk a little bit about concierge medicine, which is one of my favorite topics.
Okay.
During our commercial break, you're going to hear some great messages from 2 different sponsors, one being the Oquendo Center, which is a surgical training center right here in Las Vegas. A lot of people don't realize we train about 7,400 surgeons each and every year right here in Las Vegas, Nevada at the Oquendo Center. And the next one's about our upcoming annual gala for Las Vegas Heals, the Inspired Excellence in Healthcare Award. So enjoy a quick commercial break, and then we'll come back to talk a little bit about concierge medicine.
Join Las Vegas Heals as we celebrate the Inspired Excellence in Healthcare Awards on Thursday, October 24th, 2019. Las Vegas Heals will return to the magnificent Four Seasons Hotel to recognize and celebrate 6 more honorees. Be sure to save that date, again, Thursday, October 24th, and be on the lookout for your personal invitation. If you know a physician or healthcare leader worthy of recognition, consider nomination. Nominations open on May 31st. We look forward to seeing everyone at the Inspired Excellence in Healthcare Awards on Thursday, October 24th, 2019.
Welcome back to Inside Medicine. We're here in the studio right now with Becky Torres, the owner of BrightStar Care Las Vegas, who owns the franchise in West Central Las Vegas. We're going to talk about one of my favorite subjects, concierge medicine. It's becoming popular. Tell us a little bit about concierge medicine and what you're doing in that space.
So when I first started BrightStar, I really had not even heard of it. And I didn't really realize there was a space for it, how we were going to get into it. And one of the first times that it really came to my attention was a family here that had a mom that was at UMC Hospital and was dying and wanted to get her home. And they said, we're going to do anything to get her home. And it took all of us teaming together. We set up an ICU in her living room, and she was able to live there for 2 months and live out her days. They didn't want to stop treatment, so they didn't want to put her into hospice. Mm-hmm. So we came in and stepped in and were able to really help her and spend those last few months of her life, surrounded by a great team. And so this is something that after that I thought, gosh, nobody else really is doing this. Why not? And I had a situation over the summer. My 19-year-old son broke his leg and ended up in the hospital having to have surgery and spent a few days in the hospital. And we had a great experience over at Dignity. It could not have been better. But I realized that I became, the patient. I was on the flip side of this and sitting in the hospital and giving up my life for 3 days just to sit there with him when, this is something that he could have been doing at home. And so I realized right then and there that, wow, this is, hospitals, they want to get you out. They want to get you home. But what's going to happen when you get there? And so for us, we are really able, obviously it's expensive. You want to have a nurse around the clock, that is something that we do, but it costs a lot of money. And for those families that can afford it and they want to have that high level of care, we're able to provide that. And one of the things that I said, I feel like airlines and healthcare are the last 2 places that we don't have like first class. Yes, you can sit in a first class seat in an airline and it's not really that great of an experience. And I feel that healthcare is the same way. Here in Las Vegas, everything is VIP. You get in a line for a VIP this, VIP that. You get, door-to-door service, everything. Well, we don't have that in healthcare. And I feel like that's something that's so lacking. And so it's really an area that we're really focusing on building and having those people. We have, a lot of clients that really want to be at home and they need high levels of care. And we are able to step in and provide that.
Speaking of the VIP service, we're in Las Vegas, Nevada. We have 44 million people a year that travel through the destination. Now you're able to take care of patients in a hotel room as well as the home. Tell us a little bit more about that.
So I think this is such a great, we are a huge tourist destination and we get calls all the time about, I'm coming to travel here and, they might have a health condition. For example, somebody that's a paraplegic or quadriplegic, they have certain medical protocols that need to occur when they're on vacation. And so we are able to step in and provide that service for them. And, think about, if you go on our website and we have Google reviews from people that have traveled here and said, you are my lifesaver. I had the best vacation because of the care that you guys were able to provide. And so once again, my son, we had an Alaskan cruise this summer that was scheduled for my mom and dad's 50th anniversary. And he had to go on crutches and, navigating a vacation like that. And it was very eye-opening. And so once again, we're able to go in and help families. Sometimes they want to bring grandma with them, but grandma doesn't want to go, she isn't able to go out on this trip for, the 15 hours that they are, and they need somebody to help get her to bed. It's as simple as that to, really extensive medical treatment.
And so that's a unique service. Are you aware of any other agencies that are providing that?
No, I am not aware of any.
And so that's amazing because it helps somebody travel with a loved one that may need to seek out additional care, and you're able to provide that. And I think that helps the destination. That helps us with our mission as Las Vegas to get more heads in beds, as we call it.
Exactly.
So besides that, what are some of the other trends that you're seeing out there in the healthcare space right now? Like, what do you see? You see things that many of us don't because you're hands-on. What are some of the other trends that you're seeing?
So the trends that I'm seeing are, once again, obviously with hospitals and insurance companies, and it's getting people in and out much quicker than in years past. We have a shortage of caregivers and a shortage of nurses. I mean, that's a huge topic for us, really trying to become an employer of choice here so we can bring in the best talent. And, nurses, I wish my 17-year-old daughter would be a nurse. She doesn't want to, or my 19-year-old son, they don't have an interest in it. And I keep saying, no, do this. You could really,
Yeah, we definitely need more nurses. We need more allied health professionals. We need more doctors. It's just shortages everywhere.
Yes. And I see the trend is that it's going to get much, much worse. And I read an article in the New York Times the other day about a live-in caregiver there that's making $160 a day and is working, 18 hours a day because the person she's caring for has Alzheimer's. And, you at some point somebody has to make a living wage, but we also have to care for our elderly. And so it's this balance of how are we going to solve this problem? And I don't have an answer to it, but I think it's going to become a crisis for our country.
So how does a family member realize or diagnose that they need home health services? How do we have somebody at home, we're doing our best, but it's now above our ability to deliver that care? How do you discover that?
It's the little things, it's often, we have families that don't live here and they come over, over the holidays and visit mom, and they realize that, wow, mom hasn't had a shower, or mom is forgetting things. She said something to me that she told me 2 minutes ago, or they'll go into the refrigerator and there's a lot of expired food. They notice they're not eating, they've lost weight. So it's those little things that start occurring. And the problem is knowing when to bring in help, because everyone's resistant to it. If I told you right now that somebody's going to be at your house helping you, you would say, no, I don't want that. And so it's the thought of them losing their independence. And this is something I do in my training when I talk to our caregivers is, you guys need to understand that they don't want you there in the beginning. And, eventually they're going to get used to it, and you're going to be a beacon of hope for them. But in the beginning, and it's, if somebody's really, really sick, it's easy to get care in there. It's when it's just starting to happen and they don't want somebody around them all the time. And I always say to families, start slow. You don't need to start with having somebody there 8 hours a day. Start with a couple hours, get somebody used to the fact that, a lot of the times it's the driving, how many people should not be driving anymore, and they don't want to take the keys away, but it's becoming a hazard. And so that's one of the first things we see is the driving.
So when a family member discovers or realizes that they need to bring in a caregiver, what are some of the questions that they should ask that caregiver before making the hiring decision?
Well, first of all, you need to hire a licensed agency. I cannot tell you the horror stories that I've seen with hiring somebody off of Craigslist. You have no protection. Yeah. I tell a story. We were signing up a client the other day, and our caregiver walked in and the dog bit her. And he's, the client says, "Oh, I'll pay for everything." And, my person looked and said, "That's why we have workers' comp insurance. It's covered. Don't worry about it." It's those type of things. We had another family here in town that was hiring private caregivers, and they fired somebody and they got sued for unemployment. And
geez.
Things like this that you don't even think about and realize. So the first thing is really vetting your agencies. And I tell everyone, you should interview 2 or 3 agencies. There's a lot of great agencies out there. There's, some bad ones for sure, but there's a lot of great ones. And you need to interview an agency and see what works for you. It might be price driven. It could be the fact that, you want to have a team that's really big. You might want to have a smaller team. It's really those type of questions. And you need to ask and make sure that they're doing background checks on everyone. That's a huge thing. We're required by law to do it. We're required by law to TB test everyone. The training, to ask them what kind of training they go through and what their level of experience are. And what happens if somebody, calls out? Who's going to go? Are you going to leave mom laying there for a day because you don't have another person to fill that shift? I mean, all of those things that really are the type of, and, it's a personality match. I mean, sometimes I say, sometimes I feel like a matchmaker more than anything, because I meet a family member and I say, oh, I've got the perfect person for you. And, I'm right a lot, but if I'm wrong, then they call up and say, that's not working. And then we're able to, it might take 2 or 3 tries, but it's finding that right person that's going to make their lives better.
When you have 180 employees, you're able to backfill when you need to backfill.
Yes.
So we've covered a lot of territory here. Is there anything that we did not talk about that you want to make sure that our audience, and keep in mind our audience are primarily providers and other folks in the healthcare space. Is there anything else that you'd like to make sure that they're aware of BrightStar Care?
I love our healthcare community here. I think it's, I'm very new to it. I mean, I didn't grow up in it, so it was new. And I said the level of support that I get from other owners in this, from people like you, physicians, everyone, I think it's really great. And I love the thing that you're doing with bringing people together in our community. And I think it's very critical that we all remember that we're all in this for the right reasons. And, I always say that cream rises to the top. And when you surround yourself with the people that are doing the right thing and that are really making a difference in our community, it makes all of us better. So I think it's been very, very eye-opening about how wonderful our community truly is.
Yeah, thank you. Las Vegas Heals, we strive to bring the healthcare community together each and every day. We've got groups that employ about 34,000 healthcare professionals that are actively involved in Heals. So we appreciate everything that you do for us. If our audience wanted to get in touch with you, how do they do that?
Website, www.brightstarcare.com, West Central Las Vegas location. Our phone number is 702-982-2273. We answer our phone 24 hours a day.
Very good. Well, thank you all for joining us for another edition of Inside Medicine, and we hope to see you back next week, Thursday at 10 a.m. Make it a great day.